بنرحب بالدكتور ربيع شماعي مدير البرنامج الوطني للصحة النفسية بلبنان وزارة الصحة العامة يلي رح يقدم مداخلة عن إعادة هيكلة نظام الصحة النفسية بلبنان.
It gives me great pleasure to be talking to you today about the mental health reform in Lebanon that has been ongoing since 2014. To go through the presentation, I'm going to start with an overview about the background on mental health globally a bit, focus more on the Lebanese context before the reform, speak about the reform, and then end with some learned lessons at the end. As you may know, the global burden of mental health is around 13% of DALYs, which is the disability adjusted life years, which means 13% of the burden of the total health is linked to mental health disorders. Whereas the support or the governmental budget dedicated to mental health is around almost 1% in developing countries. 4 of the 10 conditions that are responsible for the biggest part of disability or mortality worldwide are mental health conditions, with depression being the top one, causing almost 11% of the DALYs. To focus more on the Lebanese context, for those of you who may not know, Lebanon is a very small country on the eastern Mediterranean Sea with a population of almost 6 million, about 200,000 Palestinian refugees, and since 2011, we have about 1 to 1.5 million Syrian displaced, on top of a long history of civil war and unrest. And within this context, the mental health system has been really chronically underfunded, mainly based in chronic long-term institutions or in the private sector, with the Ministry of Public Health before the start of the reform only covering inpatient care and psychotropic medication. Building on the humanitarian response to the Syrian crisis, the Ministry of Public Health chose to have a long-term vision for mental health. It started by establishing a coordination mechanism, the MHPSS task force, that is chaired by the program, co-chaired by WHO and UNICEF, and inclusive of all partners working in mental health in Lebanon. Second, it launched the National Mental Health Program with the support of WHO, IMC, and UNICEF in 2014. And the year after the launch of the program, it developed the first national mental health strategy for Lebanon, aligned with WHO Global Action Plan to reform all the system, avoiding by that building a parallel system for the humanitarian crisis and another one for reforming the mental health system in Lebanon. And this choice proved to be a good one, as you will see now from what I will be presenting in the next few slides. In 2015, the ministry launched the first national mental health strategy for Lebanon 2015-2020 with the vision that all people living in Lebanon will have the opportunity to enjoy the best possible mental health and well-being. The process of developing the strategy was a participatory process inclusive of all actors and stakeholders implicated in mental health and psychosocial support in the country. The strategy has 5 domains. The first domain is for leadership and governance. The second is for reorienting and scaling up services. The third is for prevention and promotion. The fourth is for the health information system and research. And the fifth one is very specific for Lebanon and is inclusive of 13 vulnerable groups for which we have specific objective to ensure that everyone's needs in mental health and psychosocial support are met. In 2018, we conducted an independent external midterm evaluation of the strategy implementation commissioned by WHO Lebanon. In conclusion, the report showed that the work of the reform is ongoing and on track, and much has been achieved and a lot is still to be done as well, specifically in terms of scaling up services and deinstitutionalization, which means increasing community mental health services and decreasing the number of beds in big institutions in Lebanon. Now I'm going to zoom in on each domain and speak with you a bit about some of the achievements that were done in each one of them. The first domain, which is the leadership and governance domain. Within that domain, we were working mainly on changing the laws. We've been able to pass a law to regulate the profession of psychology, and we have 3 project laws currently being discussed in the parliament, but due to the current crises in Lebanon, the political, economic, and health one, all the legislative work has been a bit paused, as you may know. So the 3 other laws, there's a law for the mental health specifically to regulate the mental health in line with the human rights, so focusing more on involuntary hospitalization and ensuring that the human rights are respected. The establishment of a department for mental health in the Ministry of Public Health. And the third big component of this law is the scale up of community mental health services within the country. The second law aims at decriminalizing substance use, through which pushing people who may have substance use disorder from the legal system to the health system, enforcing again that addiction is mainly a health issue first and foremost. The third law aims at establishing an order for the mental health professionals, specifically for psychologists who are now being licensed by the Ministry of Public Health. In addition to this, different mechanisms of coordination have been put in place, and we've been able also to publish an interministerial strategy for responding to substance use in Lebanon. The second domain is about service organization. You may be familiar with the WHO pyramid for optimal mix of services, through which you start by building the different levels of the pyramid. I mean, if any one of us is struggling with distress or mental disorders, and generally what we try to do is try to help ourselves. This is where you will see the self-care. And if we're not able to help ourselves on our own, what we do usually is that we seek support from family or friends, which is the informal support in the community. If this is not enough for us, we should be able to talk about our mental health to our GP or family doctor, for which we're right now working on integrating mental health into primary care. If this is not enough, I should be able to speak to a mental health professional within the community setting, and you will see also in this layer community-based mental health services. And if my case actually needs acute inpatient care, it means that I need to go to the hospital for a few days just to take care of myself, revise my medication, and being followed up closely, I should be able to access this service in any general hospital. So psychiatry should have a ward in any general hospital in the country. And very few people might need long-term institutions. If you look at the system in Lebanon before the program started, actually it was more of an inverted pyramid, with most services being at the institutional level and very little services available at the primary care and at the community. The work of the program and its partners, because the program works in a collaborative governance model with a lot of partners from the INGOs, local NGOs, the PHC departments, WHO, UNICEF and other UN agencies, are working on integrating mental health into primary care and scaling up community services so people can access services where they are. Adding to the scale up of the services, what's really been ongoing as well is the development of normative framework and mapping tools that help people access services. We've been using WHO Quality Right Toolkit to assess human rights at the level of the mental health institution. In addition to this, building the health information system and developing an online platform for mapping the services through which all partners map their services, and we have on one map all the services available, facilitating through it the access of people to services. The third domain is that of prevention and promotion. And we understand very well the importance of prevention and promotion when it comes to mental health, starting even from the early childhood development and even from before the person is born. And for that, there has been different initiatives that we've been working on to promote mental health and prevent mental disorder. we've developed and launched with Embrace the national hotline for emotional support and suicide prevention, 1564, that receives calls from people in distress who have suicidal ideation, that can support them directly and refer them to services close to where they live. In addition to this, we've been working on adapting life skills programs with the Ministry of Education, Ministry of Social Affairs, and other partners to try and implement them at the level of schools or for youth who are outside the schools. And we've been working closely with UNICEF, UNODC, SIDC, and also Mentor Arabia specifically for these projects. But unfortunately, due to the COVID situation and the fact that children were no longer going to school, this has had to be at some point paused. In addition to this, we're working on an early childhood development strategy framework with the Higher Council for Childhood in Lebanon, with the aim of having a life cycle approach to mental health. In terms of health information system and research, we've been gearing research towards research that will inform the scale up of evidence-based intervention. And within that scope, we've been working closely with WHO for the last 5 years on an application called Step by Step that we've tested on 1,250 persons almost, and found it to be effective for depression. This is an application through which the person can use self-help technique, and they can receive a call also or a chat once a week by an e-helper to help them through the process. In addition to this, we're currently preparing for a big study also with UCL on maternal mental health and child development, with the aim of using group interpersonal therapy for mothers with depression and measure the impact on the development of the child. As you know, depression sometimes and mothers can link to negative outcomes in development in the children, and we're aiming at improving that. Also, with London School of Hygiene and Tropical Medicine and St. Joseph University, we're working on understanding the financing and the governance mechanisms of mental health systems within a complex, fragile settings with refugees and host communities, as is the case currently in Lebanon. And through all these years, we've been working closely also with Colombia on studying and scaling up IPT, which is an evidence-based therapy for depression for people living in Lebanon. Last but not least, as you see, we have the last domain for vulnerable groups, where we have identified through the process of development of the strategy and the discussion with the different stakeholders, 13 groups ranging from foreign domestic workers to persons living with disability, persons living with HIV, survivor of torture, survivor of SGBV, the LGBT community, displaced population, and refugees. So for each group, we have specific objectives that we're working on to ensure that no one is left behind and that everyone is included when it comes to mental health in Lebanon. An important role of the National Mental Health Program is to be able to be responsive to what's happening in the context. And as you may know, in the last couple of years, Lebanon has been through multiple crises. The first one has been the COVID-19, and the National Mental Health Program with WHO and UNICEF were able to respond quite quickly through developing a intersectoral action plan for MHPSS, mental health and psychosocial support, with different 4 goals right now, aiming from promoting mental health and tackling, mitigating risk factors such as stigma, to supporting people going through COVID and health workers who are responding to COVID, and also ensuring that people with pre-existing mental disorders have access to mental health services in a way that is aligned with the infection prevention and control guidelines. We had different activities, as you can see through the slides. We did a big campaign also targeting stigma, and I'm going to show you now a short video that you can see also about the video that aired on television and through the main primetime news on different channels in Lebanon.
العالم كله خايف، عايش نفس الواقع، والخوف مبعدنا عن بعض. طبيعي نكون خايفين حتى لو الحياة عم ترجع شوي شوي لطبيعتها. خايفين على حالنا، على يلي منحبهم، لأنه كلنا معرضين. الفيروس ما بيميز. بس ما في عيب ولا حياة إذا الفحص طلع إيجابي. مش هيدا الاختبار الأهم. الاختبار الأهم إنه ما نحول خوفنا على صحتنا لخوف من بعض. إنه نشوف الإنسان مش المرض، ونتذكر إنه ما عمل شي غلط. الاختبار الأهم نوقف حد بعض مش ضد بعض. لأن يلي فيه مرضنا مش بس الفيروس، يلي فيه كمان يمرضنا هو إذا تخلينا عن محبتنا لبعض.
August 4, 2020, a big explosion hit Beirut, decimating half of the city, killing more than 200 people, displacing more than 300,000. Having a rapid MHPSS response to cater to the needs of the survivor was of eminent importance. And for that, the program was able to formulate a quick intersectoral action plan to respond to the needs. But we were very clear into not medicalizing a social or a security problem. Our position was clear in the sense where we said that justice is the first step to help people heal. And meanwhile, people who are suffering, people who are in pain need to have access to services. We started different also activities, helping people to learn more about normal reactions, how to help themselves, how to help their children, and how to cope with stress and where they can access services. Being able to respond in a timely manner was crucial to be able to help people going through this difficult period. What have we learned through these years and through working as a national mental health program, responding to the needs of the population while working on reforming the mental health system? A lot of lessons have been learned. I'll highlight here 3 main lessons that I think were crucial to help us do the work that we did. First, the importance of having a governing body at the level of the Ministry of Public Health for mental health, being able to coordinate and bring all actors around one vision for reforming the mental health system, which is written through the mental health strategy. The second element is having a collaborative governance model in which everyone is a full partner from the decision-making to the implementation. The third is using crisis as an opportunity to build back more resilient and more effective mental health system, starting from the Syrian crisis that led to the establishment of the program, going through the different crises to which the program has been responding since its establishment in 2014. I hope that this quick overview of the work of the National Mental Health Program in Lebanon has given you an idea about the work that we've been doing with our partners, and I hope that it will inspire you to go through, despite the difficulties that you might be facing, reforming mental health system wherever you work.